here now, former Republican Senate Majority Leader and world-renowned heart surgeon Dr. Bill Frist, and also he's the author of the new book, A Heart to Serve, The Passion to Bring Health, Hope, and Healing. Also with us, Washington Post correspondent T.R. Reid. He's the author of The Healing of America, A Global Quest for Better, Cheaper, and Fairer Health Care.
There we go.
Senator, let's begin with you. Have you been distressed at the outlines of this health care reform debate over the past 6 to 9 months? Seems to be sound and fury signifying nothing.
Yeah, we've got huge problems in healthcare. And I say this as a physician practicing, as a policymaker, mainly in costs going up too fast and the uninsured. We need transformational change, and what's going on the floor today in the Senate and the House is not truly transformational. It's more of what we've had in the past, which is raising taxes, squeezing down, nothing in terms of changing behavior itself in terms of the practice of medicine.
And you say what's happening on the floor today, but it's been happening for the past 6 or 9 months. The systemic challenges to this healthcare system are epic, and yet it doesn't seem like anybody's willing to take them on.
The biggest disappointment to me, having been the majority leader and sat there and gone through another major bill, the prescription drug bill in 2003, a very expensive bill, a bill out there that did end up being very, very good, is the lack of working across the aisle. Yeah. We don't have anybody working with each other right now, and that's what bothers me the most. So it's hard to get new ideas coming in.
TR, if you look across the world as you've done at healthcare systems, how healthy is our healthcare system compared to other industrialized nations?
Look, some people in America get the best care in the world. The problem with our system is we leave tens of millions of people outside the door. They don't even get in. All the other developed democracies, countries like us, cover everybody with high-quality care, and they spend half as much as we do. We could learn a lot from those countries. That's why I wrote the book.
What are we doing wrong? And this should be something that would bring Republicans and Democrats together. We spend more money. We waste more money. We're more inefficient in the health care than any other country on the planet. We can't figure out a way to come together on that issue?
Well, that's what I say in my book. I mean, Taiwan covers everybody and spends less than we do. If Taiwan can do it, the United States could do it. I know we could do it because all the other countries do. Here's what they did that's different. All the other countries first decided on the goal. Doggone it, we're going to provide health care to everybody who needs it in our country. Once you commit to that, you can find a way to do it. We've never made that commitment.
The thing is, though, and this is something that hasn't come out really in the debate either, Doctor, is the fact that if you want a hospital and somebody comes to your hospital and they ask for care, you give them care. Everybody gets health care. It is not equal health care, but everybody gets health care, and it's awkward, it's horrible, it's anarchic, but we should figure out a way to get everybody covered, since we're having to do it anyway.
We have a healthcare sector out there, but not a healthcare system. When I do a heart transplant, 52 different entities actually bill for that heart transplant with no coordination, no exchange of information, no real accountability for the outcomes of the results, but just reimbursement based on fee-for-service. The more quantity you do, the more you get reimbursed, instead of having a system which can be designed that's on outcomes, results, on not volume but value based.
And TR, there is this concept that we offer the best health care, and as you said, some people in this country, but there are statistics overall in terms of how we're doing that rank us lower than many other countries.
Yeah, that was one of the most disappointing parts of doing my book was among the 23 richest countries, we rate 20th to 23rd at the bottom on many areas. We're really good at curing breast cancer. We're number one at that.
Infant mortality always.
Infant mortality, we're the worst. We're the worst at keeping our babies alive of all the rich countries.
Yeah, let me just jump in a second, because people say we spend twice as much, our outcomes, we don't live as long, infant mortality is higher, therefore we need universal health care, single payer, whatever you're arguing. And that's a false argument. If you look at how long we live, health services itself, doctors, insurance and all, is probably about 15% important. 40% is behavior. It's obesity, it's smoking, it's seatbelts if you look at the burden of disease and if you look at the cost of health care, and 30% is genetic. So to say that just universal health care bringing people in is going to make us live longer is false. You've got to look at behavior, you've got to look at obesity, you've got to look at prevention, you've got to look at wellness, and that has nothing to do with universal care or how good a doctor is.
Bill Frist?
Yeah, but doctor, you know, all the other countries have those lifestyle problems. In other countries,
they do not have the obesity.
They smoke more than we do.
They do not
drink more than we
for 30
do.
years, they didn't smoke more.
Well, they do now. And
they don't
you
have the
need to
obesity.
provide care to people, and that's the problem in our system.
First of all,
we don't.
I
And
agree.
the other countries cover everybody.
I agree. We need to bring them in to eliminate adverse selection, pre-existing illness. But to say that's going to make us live longer is just not true.
We'll leave it there, but we'll continue again. Bill Frist and T.R. Reid, thank you so much.